Hey everybody, excited to be speaking with you again this week. Today I'm addressing a big question I've been getting a lot of recently, and that is, how do I know if therapy is right for me? Because I know a lot of you guys have either been in the situation where you've gone to therapy a couple of times, maybe you've been going for a couple of months or a couple of years, maybe it's an option that you're considering right now. And I've never come from the philosophy that our team and myself as a coach are your only option. But I do believe that you need to be informed about what you can expect depending on which option it is that you choose, both in terms of the outcomes that you're likely to experience, as well as the methodology that is going to be implemented in order to try to actually create solutions for your problem. So here's a little bit about what to expect in a therapeutic environment. Now, a couple things I'll say right off of the bat are, as you've heard me say, I truly do believe that therapists and counselors are incredible human beings that care deeply. They truly do want to make a difference, and they're doing their absolute best that they possibly can. The challenge I have with therapy as it stands in terms of a central pillar in the mental health industry is that it is kind of doing a lot of the same things that we used to do to address mental health 50, 60, so even 70 years ago. And if you think about it, we don't do just about anything the same way we used to do 50, 60, or 70 years ago. Usually those methods are very outdated for just about every other area of life, and mental health is no exception to that. And so some of the ways in which therapists and counselors are systematically trained to look at the issues of mental health and how to address them create a few challenges that you need to be aware of. And depending on what your goals are, they may be things that you're happy to see past, or they may be major impediments to what you're trying to actually achieve. So the first thing to understand is there are two kind of major tenets to traditional therapy or counseling in terms of how these professionals are trained. The first is that most people come from what is called the somatic school, okay? And the somatic school essentially believes that your depression and your anxiety can be almost completely defined and understood from the perspective of your biochemistry. Now, don't get me wrong, that's entirely useful for us to look at, but in my years of experience, I can share with you that what's going on biochemically is obviously important to take a look at, but it is not the underlying source of what's going on with your challenges. And if you doubt what I have to say about that, then just reflect on your own experience, particularly if you've tried the medication route, or if you know individuals who have. Because in my experience, 19 out of 20 people who go that route of trying to manipulate their biochemistry really do not see very strong or lasting results. Usually the period in which people see big improvements is between 2 and 6 months. And then after that, they run into instances of having to up their dosages, or they run into problems with chemical dependencies or other challenges like that. So the big thing to understand is we can manipulate your brain chemistry all day, but that's not going to actually solve the underlying problem. If you're having a suicidal thoughts, for example, we can artificially, change what's going on inside of your nervous system to make you feel less bad or feel a little bit more numb as opposed to those sharp lows. But if you're still systematically in a conditioned pattern of thinking that is causing you to feel suicidal, then you're going to have a big challenge there. So that's one of the big impediments for a lot of people who are looking for a real solution, is they enter into an environment with a professional who's viewing their problem primarily as a biochemical issue. And I just would say that, if you're really looking for a real solution, I've never seen that path really produce that outcome for you. Okay, it might be useful if you're trying to just get through the days a little bit easier or get through the weeks a little bit better. But if you're really looking to overcome this, it's probably not going to be a route that's going to work for you. Now, another big thing that you're going to look out for in a therapeutic environment is what we call non-directive therapy. And so, when you go into the environment of a psychiatrist, psychologist, or counselor, what is likely to happen is your very first session, they're just going to spend trying to get to know you. It's going to be about trying to get background information, and they can end up spending, several sessions telling you, look, we're just here to get to know each other to get started, and that's how this whole process begins. And what you're going to probably get a sense of very early on is that you're essentially walking into an environment where the professional believes they're going to be with you for several months, maybe several years. So you also need to take a look at what timeline you really want to be working under. Do you really want to be struggling with your depression or your anxiety for years or even decades? Because what you deserve to know is that that is the result that usually happens in a therapeutic environment. Now, again, it's not every single instance, but out of the people I consult with year after year, I can tell you that the vast majority of cases are ones in which people are still dealing with the same issues they came to the therapist with, even if they've been in therapy for years or decades, okay? And that's a very challenging and frustrating experience for you to be in. So when you start out in therapy, that's very often what will begin, is you're going to spend a lot of time just trying to get to know each other and open up a little bit. The next thing that you're likely to experience is a feeling of relief. You're actually going to feel a little bit of a sense of progress. Now, it's important to understand where this feeling comes from and why this would be emanating almost always. So what happens very often for people is when they get into an environment of therapy, they're now getting things off their chest. They're venting. If you found a therapist that is, actually understanding and empathetic, they will, treat you with respect. They'll make sure that you feel that you're heard, and you're going to feel finally like you're making a little progress simply because you've got a place to let the steam out, okay? And so that very often will be something that you'll feel for the first month or two. You'll get this kind of sense of release. After the first month or two, very often what I get reports of when I consult with individuals who've gone through this experience, and how I know the training of these individuals is oriented, is you're very often likely to experience a plateau. And so what will happen is you've gotten that sense of relief in the early beginning, and then all of a sudden you realize, why do I still feel the way I did when I first began? Or why am I still dealing with the same issues? Or why am I dealing with more significant issues than I did when I first signed up for therapy? And the big challenge with that is what I call the broken patient myth, okay, which is another big element about how therapists and counselors are trained that you might have heard me speak about before. But essentially what you deserve to understand is that 99.99% of therapists and counselors do not believe that your depression or your anxiety is something that you're going to actually fully overcome. They believe it is something that you're likely to have for the rest of your life to some extent. Okay? Now, I have a very serious professional disagreement with that, because if you're going to somebody who is supposedly supposed to help you create a solution, and they're going to, essentially reinforce the idea that no solution really exists, but all they can really help you do is learn to cope and accept your problem, I don't really know about you, but what are your real chances of actually making lasting improvement? I mean, is that the person that you would want to go to actually help you create a real solution to your problem? I would assume probably not. So, this is why I always say therapy can be helpful, but it depends on what your goals are. If your goal is simply to have somebody to talk to just get things off of your chest and get a sense of relief and have like a little release valve every couple of weeks or so, therapy may be helpful for you. But if you are dealing with serious, systemic patterns of deep anxiety or depression, talking is never going to be enough to actually overcome your challenges. Okay, and this is why very often after about month 3, people will start to feel a plateau, and eventually you'll start to feel a sense of frustration, like, why is my therapist or counselor not getting it? Why am I not getting more from them? Why am I not getting real ways to actually create solutions? They're likely to throw a couple coping mechanisms your way. They're likely to teach you a couple breathing techniques. They may have you start to journal. They may have you count backwards from 10. They may have you do a couple things like that. There are also some professionals trained in CBT, or cognitive behavioral therapy, where they may try to work with some of your thought patterns and those types of things. So you may experience some progress on the edges, but here's what I'll share with you. If you're still dealing with systemic and deep patterns of depression or anxiety after 2 or 3 months, then you're not likely in an environment with a professional who can actually help you overcome your challenge, if that's your real goal. And I say that not because I believe I have all the answers, certainly not, but I say that because when you actually know where to look for the sources of depression or anxiety, it really only takes about 60 to 90 days to actually naturally overcome even the most serious cases of depression or anxiety. And by the way, I don't take that statement lightly. I take that statement with the full credit and authority of having seen it happen so many times and knowing that it can be possible for anybody who's committed and open-minded. Now, this enters us into the next and pretty much final stage that you're likely to experience in a therapeutic environment. So very often, unfortunately, what happens for people, and this is not every case, but very often what happens is your therapist or your counselor will get the sense that you're looking for more from the therapeutic environment than they can really offer you. And this is very often where the recommendations for medication come in. This is very often where sometimes they believe that you guys should stop your work together and that you need to go, see somebody else, or you need to go take some time away from therapy. And this is very often also where you will start to notice that sometimes a therapist or counselor can start to get angry and deliver some what we call patriarchal advice, where it's kind of like, well, what you need to do is this, and what you have to do is that, okay? Now, by the way, I am painting with a little bit of a broad brush. I do not mean to box every therapist and counselor in this category, because not every one of them will do this. But I am sharing with you that if you've experienced this is a telltale sign that you're in an environment where your professional feels like they are limited in their ability to actually help you get to the next level. It's also a sign that if you enter into therapy, it's something to be on the lookout for, because it would tell you that you may need to do something a little bit different at that time, because you're almost running the end of the course of what you have available in terms of the results that you could produce, okay? So again, how do you know if therapy is right for you? If you're looking to just cope, if you're looking to really just try to get through the days and the weeks a little bit better, and that's really what you're comfortable settling for, therapy can help, but it likely is going to become a frustrating experience for you after a number of months. Now, if you really are looking to overcome this, if you are on board with the idea that there are plenty of other people no smarter or more capable than you that have done it, that have been in serious situations of anxiety, depression, even PTSD, who have made natural and lasting recoveries, and you are, looking to make that actually happen for you, you first of all need to go to a professional who believes that that can actually happen for you. And what you need is to be put in an environment where you're not just talking, because talking is great, but it's not sufficient. It's not going to actually dig to the layers deep that you need to actually recondition those patterns of feeling, those patterns of thinking, and those patterns of behavior that are really at the source of your problem with depression or anxiety. Okay? So as always, if you're looking to better understand what your options are and figure out what is best for you, I encourage you to book a clarity call with myself or a member of my team member. I am not from the philosophy that every person is meant to work with me. Far from it. And in fact, most people that we consult with are not yet ready to actually work with us, because we only take on people who meet a couple serious qualifications. But our goal is really to serve you. We want to make sure that you can actually make improvements on your mental health, whatever that looks like for you. So please reach out if you feel like we can serve you. Otherwise, I hope this has helped you get a little bit clarity on maybe why you haven't been getting the results you want to in therapy, or what your options really are if that's something you're going to pursue. So until next time, I'll be excited to see you then. Take care for now.